So, Carolyn, I've got a DKA here.
Royal Stoke Resource.
Is that the shoulders, is it?
So we've got word that there's a really sick asthmatic coming in. They've just rang to say that the patient's peri-arrest, which basically means they're on the verge of basically stopping breathing. You have a really heightened awareness that you're about to receive probably one of the sickest patients you'll ever see. So obviously they're worried enough that they've then given us the heads up that this patient's really not well. I think she's 28. So no, not very old at all. If she's not already arrested by the time she gets here, it could mean that she could arrest very quickly. And if we get a ventilator in here as well, when you're that close to death, every second counts. If we get a big bag of fluids as well.
Normal saline?
Yeah, litre of saline, please. Yeah. So we've got nebs, steroids, arrest drugs, magnesium. So I mean, the worst is that she arrests before she even gets here, in which case, you know, when asthmatics, young asthmatics, when they're this sick, they're really difficult to get back because their airways are so brittle.
Come on. Yep, killed it. Okay, we're going 3, 1, 2, 3.
So this is Laura. Laura suffers with brittle asthma. Around about 25 to 10 this evening, she started with shortness of breath. They started home nebulizer therapy, but to no avail. She's had multiple nebulizers, salbutamol, ipratropium. She's had hydrocortisone 100 milligrams. GCS has been going down and down and down.
She's had IV adrenaline?
She's had IM adrenaline. She's got multiple health problems as well.
She's got a red card or anything like that?
Nothing like that, that we were made aware of, no. Family are on the way. We're giving her everything we can, to be honest. Going downhill.
Okay, sweetheart. Your distance still possible. We're here to help.
Everyone's doing everything at the same time. Someone's assessing the airway, someone else is dealing with breathing, and someone else with circulation, putting IV lines in to make sure that this patient has the best chance of survival.
So what's your name?
Dying of an asthma attack is a real possibility.
I've got another 100.
Yeah, please. Give it. Possibly the anaesthetic reg to resource, please.
No. Can you just squeeze my finger for me?
Have you got any pain at all? How old are you?
Not being able to breathe and being conscious of the fact that you literally can't get any air out of your lungs must almost feel like drowning.
Can you feel a radial pulse?
Yeah.
Can you put one?
More there.
That's what this across for you.
One of the drugs that work really quickly is adrenaline. The drug that in people's inhalers, you can get a liquid form of that and start infusing it through an IV line. You can give, intravenous steroids. If you're able to turn them around in this immediate stage, these other medications are then taking effect to try and keep the patient stable.
Yep. Just trying to pre-oxygenate her and get her oxygen levels up because they're really low at the moment. IV access ×2. Yep. Section working. Is it on?
Yes, it's here.
Okay. BVM walker circuit's all connected. CO2's connected. The wingoscope, we've got a size 4 blade. It's working.
Deteriorated from a GCS point of view?
Yeah, became peri-arrest. They've given her IM adrenaline, try and improve her breathing.
Other drugs that she had? Has she had any?
Magnesium's going through, multiple nebs, steroids, very little effect. Sat to 70% on the nerve, so I've swapped it to 100%.
Yeah, brilliant.
I've got ketamine and rock here.
Is she wheezy?
She has got air entry actually, and she has managed 1 or 2 words. Like I say, but I think it's probably the adrenaline that's helped.
Yeah.
Can we get X-ray round as well, please? What's your name, sweetheart? I think it's Laura. Is your name Laura?
Yeah. Hi Laura, my name's Kerry. I'm one of the the doctors.
When you see people younger than yourself brought in with life-threatening situations who might or might not make it, it makes you stop and think, this could have been me.
Oh, gas on there, she was sat at 70, so put on 100%.
That's fine. We'll keep on that.
Obviously call for
That's for how much?
magnesium's gone.
We thought 500 might.
Their protocol
Perfect.
for.
That's
So she's doing a bit better than obviously when she first came in. Hopefully we're going to get away with not needing to put her to sleep, which is obviously better for her. So we're going to put her on something that's going to help her breathing, but it's not quite as bad as having to put a tube down her throat. She's still sick, but she's not, you know, we've dragged her back from basically her arresting. So, you know, we've managed to improve her ventilation. She's getting oxygen in now and blood pressure stabilized. Paramedics were having to give her adrenaline and stuff like that, you know. So for asthmatics, that's reserved for those patients who they think are about to die. They're giving her these really powerful drugs and then bringing us back to put on us on an increased standby because they were really worried that she was going to be so ill when she arrived that she would stop breathing and then her heart would stop. I'm Richard, I'm one of the trauma consultants here.
My husband, yeah.
We were a bit worried when she first came in, but like I say, she's responded really well.
Okay, good.
They're going to take you downstairs shortly, all right, to the intensive care unit just to keep an eye on you overnight, okay? I'm going to leave you to it. You take care.
Only seen it like this bad a couple of times before. And it's still doesn't get any easier, and you just, I suppose you don't know what's going to happen.
Who am I ringing? Raj. Hi, Raj. Got a few things going on in resus. 2 cardiac arrests, an arm injury, a groin pain, about 4 standbys in the next half an hour. Yeah? I need a trauma call going out, please. Limb injury, large laceration, arterial bleeding. Yeah, RSI 25.
Got another RSI.
Air ambulance into this one, Matt. Land ambulance into that one.
Hello, A&E, Stoke Resource.
And then this one.
So this is the HGV has hit her passenger side.
This is a 38-year-old female who's been presented today with an out-of-hospital cardiac arrest. She was driving along the M6 motorway where we understand she had a cardiac arrest whilst driving and had an accident or a collision following that. A young patient with a cardiac arrest, it's completely unexpected. No underlying problems, and then the next minute they've had a cardiac arrest. She's had a long period of downtime, so people doing CPR rather than her own heartbeat. She's young, we need to do everything we can. So Matt, we convert to a tube, yeah?
So we sent bloods off as unknown, so we need to keep her as unknown till...
Yeah, that's fine. There's
that's
nothing
all right.
on the system anyway that's related to the details that we've got, so we'll keep her unknown for now. You need to warm her up.
Yeah, just a blanket under her head as well.
Yeah. Sounds good. You've got CO2, good bilateral air entry. Well done. The anaesthetist will manage the airways to allow ventilation and provide oxygen at the highest concentration as possible. The plan now is to try and normalise everything that we possibly can, including kind of blood pressure, heart rate, heart rhythm, oxygen levels, blood sugar, everything as much as possible to allow the best circumstances for her to recover, if you like.
I've had a chat with Rob Butler, the consultant. He's happy, if you don't think anything else is going on, to angio her.
Yeah. Once we've got our big lines in, we'll go to scan.
Okay.
I'll update you with that.
Okay.
And then when you're ready.
Yeah.
Still got femoral pulse down there.
see some pressure, hey?
I'm just a resus with this cardiac arrest that's come in. She's had, how long has she been down for? About an hour, but with good CPR anaesthetist was close by when it happened.
The phrase downtime means the heart wasn't beating for itself for an hour. You don't get the same amount of oxygen going to the brain as you do when you've got your own heartbeat. Match, give us some... Yeah. Someone will be getting access, giving drugs, doing some blood tests to try and ascertain why the cardiac arrest happened in the first place.
Hayley, with your fifth pair of hands, yeah, the metronome. This is. We've just got the one cannula, Marie.
So far, love, yes. So we just need to try and get better monitoring, better access, whilst we wait to go to the cath lab for an angiogram to look and see if they can figure out why she's had a cardiac arrest this morning. And the needle from the Vigon. The central line is a catheter that's inserted into one of the big veins in the body that allows us to deliver certain medications. These are this lady's called...
Matt's just got a central line and she's got an A-line, she's tubed.
Needle from the arterial line. The arterial line is a small, narrow catheter that is inserted into an artery that continuously monitors blood pressure. Her blood pressure's come up, which is good.
Well, there's some...
Stayed in her own rhythm now for a good half an hour, which is good. To get an output and sustain your own heartbeat after an hour of downtime is unusual, and maybe partly because she's young. When we see a young patient with a cardiac arrest, we think about the family because they won't be expecting this.
It's devastating, knowing that just a couple of minutes before the accident, she was lively, happy, chatting, and then all of a sudden her heart just stops and everything stops.
She wasn't sick, she didn't have anything wrong with her. You know, at the weekend she was happy.
She's the heart and soul of
the family.
You know, any party, any cook-ups, everything. She's the main person, isn't she?
Yeah, she is. She's...
I just wanted to stay alive. That's all I wanted, just to stay alive. And that's it.
Our assumption is Leslie would have got up as a normal day, got herself ready to work and be driving to work. And the family won't have expected her to be in the resuscitation room, certainly having had a cardiac arrest. There was a long period of time between her having a cardiac arrest and having her own rhythm. So the main concern is the effect of that on the brain. The scan will be critical.
How long before we make sure we start her circulation again? Do we know? Right, yeah. So hypoxic brain injury then. No real significant bleed that I can see as yet. The foramen magnum does look quite crowded. Get that.
Leslie's brain scan shows evidence of hypoxic brain injury, which is where you get injury to the brain due to lack of oxygen from the fact that she hasn't had her own heartbeat for some time. It could be life-changing or life-threatening. OK, love. Thank you so much. Matt and the team will take Leslie to cath lab. The cardiologist will look after her there, have a look around into coronary arteries, and she'll then go to critical care unit.
So we'll take some pictures. We're going to go right femoral. If the blood pressure's OK at the minute, we'll put a balloon pump in at the end to get the noradrenaline down. If the coronaries are normal, we'll put a balloon pump in as soon as the coronaries are done. Any questions from anyone? OK, let's press on. Thank you. The issue in this lady is she's had a very prolonged downtime from the event on the motorway to coming in to here. We're looking to see whether the arteries are blocked so we can treat it. People can have chest pain, they can come to the lab, they can look like they're having a heart attack, but in fact the arteries are normal, there's another cause for it. So these are normal arteries, so we're going to stop now. Yeah. Does she have an echo downstairs?
No.
So we'll get it back on the bed and we'll do a quick bedside echo for you, make sure see what the IV looks like.
My feet ready, steady, slide.
What we don't know now is any resultant muscle damage that we see now on an ultrasound related to the primary event that's caused her to have the cardiac arrest, or is it a consequence of the fact that she was resuscitated for an hour? So at the minute there is a certain lack of clarity about why she's had her arrest, whether it's primarily heart related or whether there's another reason for it. You know, it's all normal thickness, it's just not pumping very well. We'll repeat this over the next couple of days if she survives the brain injury. Yeah. Right, can I just give you the
You're waiting too long. Hello, Royal Stoke. Take your time. Can we have emergency drugs split into this? So there's two. We do cardiac arrest. And then a limb injury that's going to be 30 minutes.
20-year-old lady has fallen headfirst off a horse.
So this is 20-year-old Abby. She was riding a horse 5 to 10 miles an hour when she went for a jump. It then dug its feet in and she went over. Mum reports that she head planted the floor, neck flexed backwards, and then she laid still. Okay. Doesn't report any loss of consciousness, she said. Mum was there at a shot. Collared and boarded. She's had 12.5 milligrams of morphine. Does feel nauseous and dropped her blood pressure to 80, which is why we started fluids.
Okay.
So you're going to feel lots of bodies on with that now.
Roll. Oh. Well done. How does that feel, Abby? Nothing major? Okay. More your neck that's sore. So she's got some severe neck pain, having fallen and hyperextended her neck, so she may have a cervical spine injury. I'm Anne-Marie, one of the consultants, madam. She's feeling a bit peaky at the minute, but the main soreness she's got, as you know, is in her neck. So what we're going to do is we'll take her around for a scan, because that'll give us the most detail about the bones in her neck. We'll do her head and neck, and also this part of her spine as well, because she's sore. So we'll get the pictures taken, we'll get the scans done, and then I'll come back and let you know what's going on.
That will stop you feeling sick. I'm still in shock, to be honest. It can't process it, because we've ridden, both of us. I mean, I've been a riding instructor for 30 years, and my daughter's, you know, had horses, and some of the most horrific looking falls, you just get up and walk away. And, you know, this time she just didn't.
I'm concerned about her cervical spine. With the mechanism of injury, it sounds like she's hit the top of her head, hyperextended her neck. So I'll be concerned about, and she's mainly complaining of cervical spine or neck pain. I wouldn't be surprised if the CT was abnormal. You all right, sweetheart? All done?
Going guys.
The scan looks okay. The bones in your neck and the bones in your back look fine. And the head scan is normal, but you've obviously, like I said to you, Abby, had a bit of a shake around on the inside, I think. That's what's making you feel so icky. I'm sorry. Okay, nice and still for me. That'll probably feel a bit better inside. Yeah. So I know you're a bit sore in the middle, aren't you?
Oh, yeah, and the front as well.
From the front as well?
Yeah, that other side.
This side?
Yeah.
Yeah, what people used to call whiplash in kind of a road traffic accident when your head goes forward and back. Hers has been forced back, isn't it? So all these muscles here have been stretched.
That's what's causing the spasm, is it? Being just the body's gone into shock.
I think she's had a bump to the head as well, isn't she? So she's had the brain on the inside's had a bit of a shake around, like concussion.
At least she's not broken.
She's not. A little bit by a little bit. All right, no problem.
No, you're not stupid.
It's good. Mum's obviously, as you would be, exceptionally concerned about her daughter. So it's nice to be able to give her some good news.
It was the fall that you look at and you think you're not going to get up. So I think I just went numb because I couldn't comprehend that it was my daughter that was in that fall. But yeah, now it's over, yeah, I'm breathing. Yeah, she's okay. So she's just feeling sick, aren't you? But that's a concussion in there. But she's going to be okay.
I'm glad it's all over now. I want to go home.
Whenever a patient is in here, everyone is very expecting that they will come out. But not everyone comes out after these situations. Unfortunately, in her case, the signs are not promising. And so we have to tell the family the truth. Hello. Hi. Hi. My name is Moses. I'm the consultant. I think we briefly met. Hello. Hi. Hi. Right. After a cardiac arrest, you can cover completely or you could die immediately. And the majority of people are in between, where you survive with the varying degrees of disability, towards the other end where you are surviving, but you are not there. The heart is pumping, but the brain is not there. We won't know that until we've done this bit for 24 hours. So tomorrow, we'll stop everything and see whether she can try and wake up. But the suggestion so far is that the brain may have been affected quite significantly.
So when you try that tomorrow, and if
she doesn't wake up, what would you do? Where do you go from there? If she doesn't wake up, we usually give up to a maximum of 3 days. If there are any signs that there may be life there.
Because you hear of people being in a coma for a long time.
This is why we're going for the 3 days.
That's not very long, is it?
No. The reason why you get sometimes people going for longer than that, it depends on what caused it. Now, if she does breathe on her own and not wake up, she may be going into that state where she has got her heart beating, breathing, but there is no brain. She's very young. Would she like to be in that state, or would you rather say, this is not what she would like? Those are the things which we should be thinking about.
I can't think about that. I know, but I can't. I wanted to die.
Well, no, I just want to stay positive.
I know what. They've got to decide whether she carries on living like that or not.
It's entirely a family decision. This lady, young patient, enjoying life, and then suddenly she is left in a state where she wouldn't be able to do anything of that. Withdrawing care is a medical decision with the support of the family and with the full understanding of why the medical team is doing it.
Oh, has she been?
You just need to wait for it. That's all, you just need to wait for it. Just open your eyes. Just open your eyes.
On the way. His anterior.
Will you let me put it back on? Because your oxygen's getting worse. Do you understand?
Just in case we need to give him a lot of blood.
Forward for Theresa's, please.
Where are we putting them to?
Guy's been shot, he's in 6. Hello, sir. Was it bleeding quite a lot?
Yes. I had a shot at the pheasant, and as I cracked it to take the cartridge out, it was obviously pointing to the ground.
Yeah.
I've shot myself in the foot.
No, it's just triggered it.
I've triggered it on.
Okay. There's this shit there.
Shot there.
Oh, yeah. Obviously, some of the shot has hit part of the bone, so you've got a small fracture of your ankle as well. You've been lucky in the fact that it's all just stayed on this side of the ankle.
Okay.
Your foot is still attached to the end of your leg, you know, and the nerves and the blood vessels appear to mainly be working.
I'm going to stick to fishing.
No.
Check the lights. I don't get that sent to you.
This is Christine, who's 89, hit by a motorcycle, probably about 30 miles an hour. And there's a lot of reports of the motorcycle, back of the motorcycle catching the back of her ankle. She's got it 6 inches by 2 inches, loss of tissue, very unstable fracture. She's had 2 morphine and then 30 ketamine titrated. Does it hurt anywhere?
Let's get right side out then. Elderly patients are doubly worrying because they have a much higher chance of having more serious medical conditions running alongside their injuries, which impair their ability to survive the injury in the first place.
85 to 90.
Ow! Ow! Ow!
Is there any pain along here, along your collarbones?
I've got my collarbones.
I'm glad you've brought those with you. Those are important.
Here,
yeah.
there.
They're not sore though?
They're not.
Good. How does your tummy feel when I prod it?
Oh, I feel sick.
Okay.
I've got a bowl for me.
It's important I just have a little feel to see if anything's hurting. Okay.
I don't know what you want to do, whether you want to come here or what, but it's her leg. Her leg is a real mess.
We'll have to do some x-rays of the left leg because we're pretty sure you've probably broken one of your bones down there.
Oh, no. Well, tell me where I am now.
This is the big hospital, in Stoke.
I'm here. I'm here. It's okay, I'm here.
What's this say?
What's this? You're in hospital, you've been knocked over.
You what?
You've been knocked over crossing the road. So they brought you to hospital. We've been here before with her ankle. She's got pins and plates in her ankle.
In that left one?
Where have you been?
I've been up to see the Doberman ladies. Do you remember?
And we think a bit of diabetes, is that
She's
right?
got type 2 diabetes.
Anything else that you know of medically?
Kidneys don't function. I forget what they call it.
Yeah. Wounds in the lower leg, particularly the anterior lower leg, so the front of the shin, are notoriously difficult to heal. Yeah, I'd say, and that's presumably dislocated looking at the angle it's at. It's already been pinned and plated in the past, apparently. We're having a look at your poorly foot.
Oh.
Your worry is always whether something's being masked underneath somewhere else.
Oh, my leg! Oh! Oh! Ow!
So we're going to do some x-rays now, okay? You never know, we just might find something lurking, mightn't we? But we'll find out one way or the other, just make sure. That way. So the major chunk of it's about there, that's the worst of the wound.
All right, so we'll get the most of it on the first.
Fib if we can.
Yeah, that's fine.
So now she's broken it right above the pin and plate. Well, that's a bit less than ideal, eh? Well,
Trouble is, when you're nearly 90, lots of things end up being more of a problem than they might otherwise be. She'll have issues in healing it. She's diabetic, which makes healing even more difficult. She's elderly, which makes it more difficult still. She's going to need more than one operation because they're not going to be able to fix that and close all of the defect in one go, I don't think. There's still potentially quite a few hurdles for her to clear. If this leg is to come off, then an amputation in this age is almost certainly going to render somebody wheelchair bound.
Hello, emergency department, nurse practitioner. Okay, cardiac arrest, okay. Yeah, bye. Got cardiac arrest coming in. Rosk.
Okay.
They are still ventilating him a little bit. 61-year-old collapse.
Return of spontaneous circulation, so ROSC for short. What stopped his heart? I don't have any knowns. The only knowns I have is that there's a patient coming whose heart is now beating and wasn't. So it was VF, 2 shocks, apparently, and then ROSC. Okay. Have we got somebody ready with an ECG machine? So we'll want one of those fairly soon. Do you want to hand over them?
This is Hugh.
Yeah.
61-year-old male. He's been out running.
Yeah.
Out in sticks.
Okay.
Come back to his car, complained, he said he felt hot. Sat in the car, he's collapsed, witnessed collapse. They've dragged him out, CPR started straight away.
How long do you reckon between you getting the call and you getting there?
No more than 3-4 minutes.
No more than 3 or 4,
Yeah.
and there was CPR still ongoing when you got there. Was it reasonable?
Yeah, she was a nurse.
Not much the matter in his chest. It sounds a bit upper airways, don't you? There's nothing screaming MI on the monitor right now. Hell's teeth. What's his pupils doing? Yeah, they'll a number of cardiac arrests I've personally dealt with who've returned to normal life.
5 mils of propofol, please.
I could probably count them on the fingers of 2 hands in 20 years.
Sorry, sir.
I think we'll get him sleep still, less clammy, and we'll get a better idea. Have you got syringes handy for blood, Jamil, or not? Yeah, you've got everything, cool. He's obviously been fit enough to go for a run today. I mean, he's 61, but he's clearly, I mean, he's got his knee braces on, but I don't know much more in terms of his past history. Something has triggered that fatal rhythm in his heart. The question is now what? His major lucky break is somebody passing who knew how to do good CPR almost immediately after his cardiac arrest. Then there was a passing ambulance crew very, very close by. Without those 2 things having happened for him, the chances of us then being able to do anything for him now would be tiny. Next thing is speak to those relatives, get that off my mental tabletop. I'll be back in 5 minutes.
Potassium 3.7, glucose was 15, sodium was 138, calcium was fine.
I've had a conversation with wife who's at home. Wife's separated from him.
Right.
He was with a new girlfriend, I think. His past medical history, according to wife, is one of the running's a relatively new thing.
Okay.
He's been relatively indolent for a large chunk of his life.
We want to take him to the cath lab.
You want to take him to the cath lab? Right now?
Right
now. That is coming. You're not guaranteed to survive going to the cath lab. When I was younger, I used to assume when you got into the cath lab everything would be well and it would be all wine and roses, but it clearly isn't for everybody. Let's hope he makes it.
Right, what are you doing to my outline? She is, she's stable-ish. We're having anti-epileptics given to her now because when we tried to reduce the sedation is when she started seizing.
Okay.
So we're going to give her, just given her a loading dose, we're going to start her on regular anti-epileptics. I'll grab her some chest.
Okay, thank you. Did you hear what she said or you didn't hear? They tried to reduce it, but she had a seizure, so they had to put it back up. I don't know what's going on in it. You just need to relax. Don't stress.
It's very, very hard to take in. And it's just unveiling itself by the hour, so we're just dealing with it as best we can. The possibility of having to make that decision for their sister not to be amongst us anymore. It's now easier for the parents because we brought them all into this world. Very difficult. Should that be the case? And we're still hoping.
Heart attack leading to cardiac arrest is the blockage of the arteries. Come here, Cordon, please. AP Cordon. RA Cordon, please. Okay, stop now. It's one of the major arteries blocked.
Where do you want them put in? 3 and 6? Yeah. Yeah, get him up. I'll just give him a once over and I'll be back. Who's this?
This is Adrian.
Hiya, sorry. I'm just in the middle of a couple of things. Yeah.
Working in the garden, do the gravel boards, lift one of them up to slide it in. It's fell back with it, just landed on his chest. Weighs about 55 kilograms. Managed to push it off, walk around.
Welcome to the wonderful world of popped lung. Yeah, okay.
Pain, the side, across the chest, lower back. He has been complaining of some pins and needles.
And his short of breath.
Leg, but he was respiring around about 38. He's had 10 milligrams of morphine.
Yeah.
He's a bit more relaxed now.
Are you worried about his neck?
It was just the fact with the back pain.
You're otherwise fitting well, sir.
Smashing.
If you didn't have a concrete block land on you. Is this where the kind of top edge of it caught you?
Yeah.
As it hit you?
Yeah.
Then you've gone down and sort of almost overextended over the wall. Not the way you'd want to go, the other way, the way your spine really doesn't want to go.
Yeah.
Okay. As you got folded over that thing, you've bent the bones really in the way that the spine isn't designed to go.
And more of the weight at this side, so.
Okay. If I pick your leg up, does that give you any grief anywhere? Yeah, it does. Where?
Near me back, yeah.
Okay. If I pick the left foot up, does
Well, my arms just went funny then.
Does that give you any grief?
That one's all right, that is.
So when I did that to your leg, you got...
Slight pain, but I can feel it on this side, the slight pain.
I'm just going to CT collarbones to pelvis.
Yeah.
We'll get your folks into you now. We'll find out who's here, shall we?
Yeah.
I'll go find them and bring them through to you. All right.
Number 1.
On the left?
On the left as you go in.
Yeah, cool. If you snap your spine, maybe you're in a wheelchair. Maybe you don't walk again. You know, his limbs are all working, but every time I move that, he gets a funny shooting pain, which makes me wonder about what's happening with his spinal cord. I think people assume when you do this job, you want people to be badly smashed and stuff, and I just really don't, because it's just awful when they are. So, hello. Are you chancy with Adrian?
Yeah. Yes. I'm his mother. This is his boss.
He said you'd be here.
Yeah. Oh, yeah. He knows
That's what he bet his fiver on.
Yes.
I'm wondering about his spine. Is the thing I'm most wondering about. You've got quite a crowd, actually.
Right, eh? You don't feel a bit better now, mate?
Bit better, yeah.
Yeah, well, that's it. At least you can breathe a bit better, mate, anyway, can't you?
Oh, yeah.
Back at work tomorrow, then?
Fishing.
Get recons and proper views in a bit. There's no blinding the obvious burst fracture, though, is there?
So nothing obvious, but we'll have a look next door.
Cool, brilliant, thank you. Turns out you'll live to plaster another day.
Oh, it's all right then, no damage.
Scans say actually fine. Scans say no organ injury, no spinal injury.
Yeah.
In order to get home, you're going to need to be able to pee for us and going to be able to walk around under your own steam. So if you can do both of those two things without going all pale and interesting, we're going to be able to release you back into the wild. All right? Okay. Back in a minute.
Can we come in? I'm very well. Oh, his son. Okay, hello. How are you?
I'm better than the last time I saw you.
This is good to see an excellent recovery. Good to see you. Okay.
Thank you.
No, I'll come. Okay, thank you. All right.
Yesterday you were asking about when you can run. It's like Friday you died. Wednesday you were asking about when can you run.
I think you were there when I woke up.
Yeah.
I really didn't know what happened. So I was out of it for a couple of days before I knew what was happening.
From Friday, I just the odds were looking against us. So to be where we are today, it's just incredible. And you had phoned me at 5:30 on Friday. I didn't answer, so I might get a little bit better at answering the phone because that might have been the last conversation I'd had with him.
Nothing's broke after 60 kilos landed on me.
It's immediately apparent to us in the resuscitation room who's been lucky and who hasn't.
Royal Stoke Resource. How long will you be?
Open your eyes for me.
We're not left untouched by what we do for a living. You do have your little moment of reflection. Could I have learnt anything? Could I have done anything different?
Water to Vegas, please, 27.
6, please.
An RTC, car versus car, near head-on collision.
That's potentially life-threatening, almost certainly life-altering.